The show is sponsored by PowerfulWomenUSA.com. Hey, everybody. I'm Jill Conway, and this is Secrets of Powerful Women, a show dedicated to celebrating and supporting strong and successful women and sharing their stories. I'm hoping you will be inspired to pursue your own dreams, reclaim your voice, and discover your strengths. So my guest today is Kim Vopni, aka the Vagina Coach. She is a health and fitness expert specializing in the pelvic floor, helping women overcome challenges like incontinence, organ prolapse, and regain a sense of control and confidence in their lives. So, Kim, thank you for coming on the show, and it's wonderful to have you.
You're welcome. I appreciate having me. Thanks so much. Looking forward to chatting.
Yeah, so this is so important, I think, for women of all ages because we're not getting the information, and as you know, and I've heard you speak on things. It's still like a taboo subject. Like no one wants to, for whatever reason, discuss it like it's a hidden, shameful secret, right?
Mm-hmm.
So I want to say this for people listening. You have too many certifications to even list, right? But I find and the names of all your programs are absolutely like fantastic. I just love them. We'll talk about them later. But I think what's most important is the certified pelvic floor instructor. And I know it goes by another name. It sounds like Pilates, but it's how do you say it? Pilates. I didn't even know that existed. All right. So tell us what that is. So tell us what you do.
So that is, that actually was created by a doctor, a fitness program created by a urogynecologist, which is not something you typically hear of. And I found Dr. Bruce Crawford online back when Instagram didn't even exist. Facebook was still just a personal platform, but Twitter came on the scene. And that was the first time there was this outreach possible with people around the world, and hashtags came into use. And I was putting in hashtag pelvic floor, and for many, it was weeks, months, nothing would come up. And then one day there was this other person who happened to use the hashtag pelvic floor, and it was Dr. Bruce Crawford. And I found his program, and he was the first person. So this is now close to probably 17 years ago.
Wow.
Whenever Twitter came on the scene, I don't remember the exact date. But anyway, I had been working in pelvic health, and anything that was really available was pretty much either like maybe a random website, but mostly books. And everything was always talking about the pelvic floor in isolation. And I never viewed it that way. Nothing works in isolation in our body, and it works the pelvic floor as part of a group. And anyway, Dr. Bruce Crawford was also speaking that language. So I reached out to him right away. I asked to try his program. I ended up working with him for a couple of years and helping him teach a course that he had. So becoming certified with him and then helping teach others. The Pilates term came because at the time, and still, Pilates is a well-recognized, a lot of people pursue Pilates, and pelvic floor. They were one of the first modalities to talk about pelvic floor. So he was leveraging that, and he was adding the PF, the pelvic floor, in front of it. I'm not the biggest fan of the name, to be honest, and I've told him that, but that's the name he chose. It's what's been used for a long time. But he was applying fitness principles to the pelvic floor, which is what I was doing as a personal trainer, now focusing in the pelvic floor. So we were a perfect synergy, and we brought the two realms of the medical kind of allopathic model versus fitness, lifestyle, movement. And we worked together for a few years. He still is a very good friend of mine. Love his program, but that was where that came from.
So what made you concentrate on the pelvic floor? Was it something you were going through personally, or just, as a health and fitness, instructor and coach that you kind of settled on? Or
growing up, I always had this fear of childbirth. I was afraid of tearing. I saw a childbirth video. It scared the pants off me. I remember witnessing things my mom would stop doing. And as I explored, she was very open with my brother and I. And she said, she was experiencing leaking when she was running. So she stopped running. She had chronic back pain. So an early picture of pregnancy, childbirth was painted for me, and I didn't want any part of that. So that was my growing up, that I'm never having babies. And then when I met my husband, decided I did want to start a family, I was determined to have a different story than my mom. And my thought at the time was, well, I'll just have a cesarean section and then everything will be fine. Right. I didn't even know the term pelvic floor. I just thought vagina, like my vagina will break. That's kind of how I thought about it at the time. And
Well, that's all,
so,
in all fairness, that's all we were really taught, right? I mean, we
yeah,
weren't taught about that there's a group of muscles down there,
nope.
right? Yeah.
Nope, not at all. And so many people still don't know the difference between the vulva and the vagina either. Everything was
Right.
always just the vagina.
Right.
And so I basically ended up deciding I was going to start a family and want to do things differently. I was using midwives. My midwives recommended a biofeedback device to me called the Epino. Epino stands
Mm.
for no episiotomy. Episiotomy is where historically they would always cut through the tissues in the perineum pelvic floor to the intention was to create space for the baby to make it easier for mom and babe. Good intention ended up not being so favorable for mom afterwards.
Mm.
And so this device from Germany was inspired by women in Africa who use gourds of increasing size to prepare their pelvic floor for birth. So this German physician saw this and he said, well, that's brilliant. However,
Mm.
nobody in the Western world is going to use gourds to prepare for birth. So can we make this into a more of a mainstream medical device? So that's where the Epino stemmed from. My midwives recommended it to me. I purchased one, had a great experience. And I said, why doesn't everybody use one of these? And I contacted the company and I said, I live in Vancouver. Could I be a distributor? And I didn't intend for it to be a business. I thought I'll just kind of start this thing on the side. But that was the catalyst. So I had used this, had a good experience, used it with my second. I ended up starting an e-commerce store with that product, but then other pelvic health products. And initially I was focused very much on pregnant women. And the
Mhm.
intention was I want pregnant women to know about the pelvic floor before they give birth, knowing that pregnancy and childbirth are one of the biggest contributors to pelvic floor dysfunction, but nobody is taught anything or told anything until
Mhm.
after when they have a problem.
Mhm.
So that was the intention, and that's how it started 21 years ago, and then it sort of has morphed and evolved into different things. But along the way was I ended up having incontinence. I ended up having pelvic organ prolapse. I have had a pelvic surgery. I've gone through menopause, the menopause transition. So I recognize that this isn't just let's focus
Right.
on pregnancy and do your Kegels and now we call it a day. This is really a lifelong journey we have with our pelvic floor, and it ebbs and flows through these life stages we go through, and we have to honor that, and but also be informed. And that's the missing piece is we just are not taught anything. Maybe we've learned a little bit about our menstrual cycle and how to prevent pregnancy back in the day,
Right.
and that's it.
Right. You're right. And then menopause, like, woo, you don't have your period. That's it. That's all
Yeah.
I was ever taught.
Yep.
Right? And not all the hell that goes with it. So
Right.
I do want to touch base on what something you said. So for people who aren't aware, what are some of the pelvic floor what do you call it?
Like
Pelvic floor.
forms of dysfunction kind of thing,
Yes,
like
thank you.
challenges. Yeah.
Yes, dysfunction.
Yeah. So I'll start out by saying the pelvic floor is a group of muscles. So if we
Mhm.
think about even wherever you are listening to this, if you take your fingers and find your pubic, people call it the pubic bone, but it's actually a
Mhm.
joint. That is one place where the pelvic floor muscles attach. The other place is
Sure.
if you pry the flesh away from your butt cheek, you'll feel a little bit of a bony point through your butt. The sits bone or ischial tuberosity, you have one on either
Mm.
side. Pelvic floor muscles also attached there. And then also the base of our spine on our coccyx or our tailbone, that's another attachment point. So those 4 points make sort of a diamond shape. And the pelvic floor muscles, which is there's 3 different layers of muscles, envelop or close that space off. So it's the foundation of our core. We've all heard of core exercise, core fitness, but we've never been told that the pelvic floor is part of that core. And the 3 groups of muscles, the first layer is primarily responsible for sexual response sensation.
Mhm.
Second layer, primarily responsible for managing the openings of the urethra, the vagina, the anus. Third layer, primarily responsible for organ support, bladder, uterus, rectum. Doesn't mean that, again, they don't work in isolation specific to that function. They are working
Mhm.
collectively as a group, but it's important to note it's not one muscle, it's many. It's 3 layers, many jobs, organ support, continence, core stability, core
Right.
control,
Right.
sexual response, sump pump. So it also works in synergy with our diaphragm to help move things, move fluids, move things throughout our body. And yet, again, maybe we've learned a menstrual cycle, maybe we've heard the term Kegel exercises, and that's it. And
Mhm.
in terms of what can start to go awry, signs and symptoms that the pelvic floor needs a little bit of help. Stress urinary incontinence. Well, I'll start sort of with the incontinence bucket. It can be urinary incontinence. It can be anal incontinence where gas or stool leak out. Stress urinary incontinence is where laugh, cough, sneeze, jump, some sort of exertion happens, a little bit of urine leaks out. This is the type of incontinence that the pad companies tell us is just part of being a woman.
Yeah.
Or we may get told by a care provider, that's what happens after you have babies, or that's what happens as you're getting older. It is very common, but you should never, ever accept that this is just part of aging and normal, and we should just put a pad on and carry on. But that's stress urinary incontinence. Urgency is where we have sudden overwhelming urges. We have alarm bells. We have to race to get to the bathroom. We may not make it. We might leak a little bit. We might have a complete release of the bladder. We can have those strong urges without the leaks, which would just be urgency, but we can have urge incontinence where we do actually leak. We can have overactive bladder, which is technically a medical diagnosis. However, many people self-diagnose themselves as having an overactive bladder because they are in the bathroom all the time. But usually it is trained behavior that is they have trained their bladder to signal them more frequently and more often. So there's overactive bladder. Then there's, again, anal incontinence, gas or stool. Then we have the pelvic organ prolapse bucket. Statistically, prolapse is actually more common than incontinence. Yet nobody has ever heard of this term prolapse. People are sidelined by this diagnosis. 50% of women who've given birth have some degree of prolapse. And prolapse is where the bladder, the uterus, and or the rectum start to shift out of their proper anatomical position, and they can bulge into or descend into the vagina. Very common, but again, never screened for. Usually an early stage prolapse is often asymptomatic, so people may not know until they feel or see a bulge right at the opening of their vagina, or they start to feel, insertion. Maybe if they're still menstruating, tampons don't go in properly or they get pushed out. They may have difficulty emptying their bladder or their bowels. They may feel heaviness and pressure or feel like there's something in their vagina. So that would be the prolapse bucket. Then we would have a pelvic pain bucket, and there's many different types of pelvic pain. Pain can be related to muscle tension. It can be related to low estrogen. It can be related to poor blood flow circulation. It can be related to conditions like involuntary spasms within the pelvic floor. So there's many different categories within pain. And it's important to work with somebody to help explore, is this more external? Is it internal? Is it muscular? Is it tissue? There's many different contributing factors. But those would be the three main buckets that people face challenges in. I'm just going to say one more thing.
Yeah.
Low back pain. 95% of women with low back pain have some form of pelvic floor dysfunction. So that's another key. If women are struggling with chronic low back pain and they've seen a physio, a chiro, massage, and they're still having to manage this, often the root cause is the pelvis.
I feel like every woman who's given birth has lower back pain that they just deal with forever. Like, oh yeah, I had a heavy child or whatever, heavier baby. Oh my God, Kim, I can't believe everything you're saying. It's amazing. It's so
I know
true.
once you hear it and learn it, you can't then, like, your jaw's on the ground, right? A lot of people are like that and they're thinking, how is it? I'm 53, I'm 54, I'm 65, and this is the first time I've ever heard of this.
Yeah, you're right. I was, I'm pretty open about, I'm 53, going to be 54. And I said this openly on a stage. I said, I can't go running. I can't jump on a, a trampoline without having something on. I sneeze. I hope to God nothing happens. Right. So, and I did finally go to a urologist because, again, I thought it was just, well, you're getting older and that's what you have to deal with. As you said, that's part of being a woman in midlife, But there are the surgeries that you can get. I mean, and now so there's new things where they can inject something almost like like a filler to help close that. But is that enough? I mean, does it work? You said you had surgery.
So yes, surgery is an option. It's on the table. Pharmaceuticals are on the table. Fillers are on the table. There's many different things that are on the table. However, well established in the literature is first line of defense should always be pelvic floor muscle training, pelvic floor physical therapy. And still a lot of people, I've been talking about this for 20 plus years, still a lot of people are like, what's a pelvic floor physical therapist? I've never heard of
Yeah.
that before.
Yeah. Me?
So I
I
think
haven't.
it's, yeah,
Yeah.
most underused women's health resource that we have. And that should always be your first step. I always say that from a young age, we've been brushing our teeth, flossing, going to see the dentist once or twice a year because we were told. I remember being in fourth, fifth grade, the dentist coming to the school. We chew this pink pill. It shows all this plaque. It's like, oh, motivation. I have to brush my teeth, and then we have to go to the dentist. And I've been going once or twice a year for my whole life. And if we had that same PR person for the pelvic floor, where we set in stone that you just go see a pelvic floor physical therapist once a year for a checkup, it would totally transform the landscape of women's health. But nobody knows that. And they usually wait until, okay,
Yeah.
now the symptoms are really getting bad and they're not just going away. Now I
Right.
go to the doctor. And with all due respect to the doctors, their training is drugs and
Mhm.
surgery. And
Yeah.
there's a place for them. But we have to do all of the other things
Mhm.
first. And there are so many things we can do to very quickly change, improve, eliminate those symptoms. So many people come into my program, they cancel their surgery. They were told that pelvic floor exercise isn't going to work. You have to have surgery for that. And a lot of people
Mm.
go down that path and it can remove symptoms, but it still never removes the need for pelvic floor physical therapy and pelvic
Mhm.
floor exercise. We don't, if we go to the dentist and we have a cavity and they say you have a cavity and they fill it, we don't stop brushing and flossing and we don't stop
Right.
seeing the dentist. We still
Right.
have to stay on top of things. And the pelvic floor is no different. It's a group of muscles that faces aging like the rest of our body. We lose muscle mass. Our bones are influenced. Think of the hip musculature, the hip structure, the hip bones. We lose more type 2, which is the quick reaction muscle fibers, especially
Mhm.
post menopause. So if we're not training them and if we're not consuming the right building blocks and doing the right type of activity to build those muscles and overcome this age related muscle loss, then we are going to be experiencing these symptoms and then being told we need surgery for it when there's really a lot we can do on our own.
Oh my goodness. So I want to you do you are a pelvic floor instructor, fitness instructor, we'll say, I guess. Um
Correct.
and I love it. And you offer this whole program, this whole community, and by the way, I'm signing up. But even better, as I mentioned before, the names that you call things. The buff muff method. I mean, hysterical. Okay. And I love it. But I love this because we're talking about exercises that, you can do through your program and you can possibly like not need the surgery, right? Like not
A
need
thousand percent. And
because
even if you still
go ahead.
do, so
Yeah.
I did, yes, I had a surgery. Had a type of pelvic organ prolapse called a rectocele, where the rectum
Yeah.
bulges in the back wall of the vagina. Early stage bladder and uterus. I reversed a stage 2 uterine prolapse in myself. I've seen many people reverse early stage prolapse. Rectoceles are very tricky to reverse. So after 9 years, nothing was moving the needle, and I decided I was going to choose surgery. Everything that I had done, like I live and breathe what I preach.
Yeah.
So that was
Yeah.
all sort of my prehab. I was very intentional with my rehab, and I didn't stop doing anything after my surgery. I argue it increases the need to do
Right.
pelvic floor muscle training because we've had a change to the landscape. We have scar tissue now that's interfering with muscle function that we have to be keeping on
Mm.
top of.
Yeah.
So even if somebody comes into the program and it doesn't completely resolve their symptoms and they do choose to have surgery, there's
Right.
no shame in that. But
Sure.
everything they've done has been putting their pelvic floor in the best state possible to undergo that surgery. And they now have the tools armed for the maintenance plan going forward. So many
Mm.
people think that surgery is the magic fix. And now, oh, I don't have to do pelvic floor exercise or Kegels anymore. I
Right.
argue the complete opposite.
I can. So, it is so much because I feel like we are blowing the lid. Oh, you've been doing it for 20 years, but for me, I haven't ever heard of any of this, right? So, the methods that you use, it's obviously a series of different exercises. And what's interesting, and everyone, I hope you look her up, the Vagina Coach on Instagram, and she has videos and things, and you're like rolling around on a ball or squeezing a ball. Uh, did you come up with these exercises yourself, or how did they come about?
Some of them I did. Some of them I learned from other people along the way. Some of them they were exercises I had learned with being a personal trainer over the years. And I
Yeah.
just was now applying, I use different tools along the way. But
Yeah.
I guess the foundation of the Buff Muff method, the foundation of what I'm trying to change as it
Mm.
pertains to pelvic health. First of all, get the information out there earlier. But
Yeah.
we if we've heard anything, again, it's Kegels. And
Yeah. That's it.
we have
Yeah.
evidence that Kegels work when they're done correctly and consistently, but we also have the evidence that most people are doing them incorrectly because they've never been taught. So it's not their
Right.
fault.
Right.
And the interpretation of Kegels is squeeze. And
Right.
so people think, okay, well, if I squeeze and if I squeeze harder, and usually that means they're squeezing their inner thighs or they squeeze their glutes or they start to hold their breath. So they're not
Or their abs or something. I don't even know how to
right.
do it
Yeah.
correctly. I don't think. Yeah.
Because you've never been taught properly. So I
Right.
make sure that people are taught. I do recommend they see an in-person therapist once a year who can help determine if you are doing them correctly for sure. But symptom improvement is usually a pretty good indication that things are going well. People that come in and say, I feel like my symptoms are getting worse, then usually it's an incorrect form or they may have excess tension already. And so by adding more squeezing, especially if you're
Right.
doing it incorrectly,
Right.
it's contributing to changes. So we know how to navigate that, and we have guidance for people of all ages, stages,
Yeah.
mobility levels. And the foundation principle is looking at the principles of fitness that I learn as a personal trainer and I apply to all of the other muscles in the body. Why are we not applying it to the pelvic floor? And why
Mm.
also did I not learn about the pelvic floor when I was a personal trainer? It's a group of muscles in the body, foundation of the core. Why do personal trainers and fitness professionals not learn about it? So I was taking fitness principles, applying it to this group of muscles called the pelvic floor that has type 1 and type 2 muscle fibers, like our
Mm.
biceps, like our quadriceps, like our calf muscles, and applying the principles of specificity. So if I leak when I run, well, I'm going to have to make some changes so that I don't leak when I run. I'm going to have to back things up. I'm going to have to establish a good connection with my pelvic floor. I'm going to have to do some imagery, visualization, releasing tension, work on my posture. Then progressive overload of fitness means if I want to get stronger, I need to impart a load or a stimulus that the muscles are then going to say, well, I have to get stronger in case she does that again. Now I'm going to go use the building blocks in the body, the protein that she's eating, the amino acids, and I'm going to use, she got to fatigue. So the muscles have a little bit of,
Mm.
technically we have a little bit of tearing when we really work hard.
Mhm.
That is then the stimulus to improve and get stronger using the building blocks that we have in the body. Many
Mm.
women don't eat enough protein.
Mm.
Many women are not doing, if they are doing pelvic floor muscle training, they're not doing it to fatigue. So they don't see really a lot of improvement, not only in their pelvic floor, but in their overall body composition.
Mm.
So I'm taking the pelvic floor as we have to establish that foundation, build upon it. Then we have to train it for strength, for endurance, for power,
Mm.
for lengthening and suppleness. We have to train it all the same ways. So when you see me sitting on that ball, that's a way to release tension in the hips, in the pelvis, in the glutes, in the inner thighs that are usually very
Right.
locked up. If you think about people who are afraid of leaking or who feel like they might not make it to the bathroom in time, or if they feel like organs are shifting and might fall out, they don't literally fall out, but that's what you feel like.
Yeah.
They're guarding unconsciously. They don't
You're
know it, but
squeezing. Yeah, you
they're
are. Right.
squeezing
Yeah.
and they're holding on. And so they are developing a lot of tension. And then when I tell people the reason you're leaking is because your muscles are too tight, they go, "What? That doesn't make any sense. How can it be if they're too tight that I'm leaking?" But that means the muscles are fatigued. They can't generate force and power. They can't react at the right time when a sneeze comes on or when you lift something. So by lengthening, letting go of tension in those muscles, now we have their full range of motion. They can react at the right time. They can generate enough force. So we have to establish those first before we then start to load it. But we apply a whole
Mm.
body approach. And then you're going to be working on your bones and your balance and your overcoming age-related muscle loss. We think about all the things that happen post-menopause. We have to address those too.
Wow, it's almost like you said, that's where I guess the Pilates part comes in, or the plyometrics, where it's like the stretching of that muscle to really get it working more efficiently, better. You just wowed me with because I never actually thought about it. Women at home might be like, "Oh, I have." That your posture and all those things are all related. Like, uh, I didn't realize that your pelvic floor is part of your core.
Hmm.
I
Nobody
seem so
knows that.
foolish. Oh, okay.
Yeah.
It's not just me.
No, not just you.
I was, I was like, I've never even thought about that, but it makes sense when you
Yeah.
say it.
Yeah. And we
Wow.
thought of core as low, maybe low back, but usually it's abs. And there's a lot of women who will also grip in their abs. They suck in their belly all day. One, because they want to make it look flatter, or two, they think that that's, I'm
Right.
working my core all day if I have it on a little bit of engagement, but that
Right.
applies pressure downwards on the pelvic floor, interferes with your breath, your digestion. I talked about the sump pump with the diaphragm and
Yeah.
the pelvic floor. If I'm chronically sucking my abdomen in and not letting it relax when I'm taking an inhale, then the diaphragm and the pelvic floor never kind of go through that sump pump relationship. So we could end up constipated, bloated, and feeling heaviness and pressure in our pelvis.
Oh my God. All right. All right. We're going to take a quick break now. Let's pause here because there's just so much to talk about. We are talking with Kim Vopni. I hope I'm saying it right. Vopni,
Yeah.
the Vagina Coach. After the commercial break, you're listening to Secrets of Powerful Women. Help me get the word out. Share this with your friends because this is so good. We'll be back. Hi, everybody. I'm Jill Conway. If you love what you're listening to, please like and subscribe to my channel on whatever podcast platform you listen to and on YouTube so I can keep bringing you these amazing women and sharing their stories. Thank you so much for listening. I hope you love it as much as I do. All right, welcome back. You're listening to Secrets of Powerful Women. Kim Vopni is with me. She is known as the Vagina Coach. And if you're listening, you are wowed as much as I am. We're talking about the Muff method. That's her program. And I encourage you to go on her website and sign up for the community because I know I am. Kim, I want to talk about the Kegels, and we mentioned it before, but when people say, oh, just do your Kegels all day, every day, whenever you're sitting down. And as I mentioned, sometimes like you just want to sit down, right? Like how often should we be doing these Kegels? And now there's doctors' offices that have some sort of device to help
The
you do the
magic Kegel
Kegels.
chair.
Yeah. I mean, does any of it really work? Or like you're saying, maybe it's like a workout, like you honestly do like work out your abs and do
Yeah.
your muff. I don't know, whatever.
So I use the term buff muff because, obviously,
funny.
I'm comfortable with proper anatomical terms. We need to know our anatomy, but it's also a heavy topic, and we need to
Yeah.
have a little bit of fun. So
Yeah, I
I
love it.
do like to have some fun with
You're
my
very funny.
terminology.
And wait,
but
can I also say you in 2009 you founded Kegels and Cocktails. I can't.
yes.
I mean, that is some good stuff and fantastic marketing, but hysterical. So go ahead.
Okay. So Kegel exercises. A Kegel, so there was a doctor, Dr. Arnold Kegel. He was the one who created a Kegel exercise. He was witnessing his patients after giving birth having difficulty with incontinence and prolapse and having difficulty engaging their pelvic floor. He used a biofeedback device called a perineometer to help women see these muscles because these muscles are inside. We don't see them. We can't go to the mirror and flex them like we do our biceps or our legs.
And you'll never really see a difference, right? Really, when you're working them, or you'll feel the difference. You'll never really.
You wouldn't necessarily see much of a
Right.
difference. You could feel a difference, yes,
Right.
if you're doing them correctly and consistently. But anyway, so Kegels, that's how they started. It's a voluntary activation, basically a contract, a lift, and a let go of the pelvic floor. But what has been interpreted over the years is just squeeze. So contract and hold.
Like you're stopping the flow of urine. Is that
Right.
correct?
So
Okay.
that's a way to identify the muscles.
Muscles.
Please don't practice your Kegels on the toilet. Every once in a blue moon, if you want to see, can I stop the flow of urine? Sure, do it as a test, but never practice your Kegels on the toilet. So
Why?
that's where
Why is
Kegels
that?
started.
Sorry,
And
I'm keep interrupting you because I'm like, wait,
that's
what?
okay.
Why? Why don't you practice on the toilet? What is that? Does that
Because
do
when we
something?
sit down on the toilet, what should happen, like physiologically, what should happen is the pelvic floor should relax, the bladder should contract and empty. And if the bladder's ready to contract and empty, but we're now squeezing and relaxing the pelvic floor, and the bladder's like, it starts to interrupt the
Flow.
connection.
Yeah.
And also, we would never really fully, completely empty the bladder then, and then we can be more prone to infection. So, and typically, I will help you with potty posture, but a lot of people will sit down on the toilet in a very slumped posture, which is also not going to allow the pelvic floor to relax appropriately. And if we're then again just squeezing more, it's not going to allow for proper emptying. So,
Oh my God.
Kegels were well intended.
Wow.
But you just said people are told, do them at every red light.
Yeah.
Do them when you brush your teeth. Do them when you're sitting down. Okay, well, even if you're doing them correctly, better than nothing. But do people leak while they're standing brushing their teeth? Do people leak when they're at the red light in a car? Do they experience heaviness and pressure when they're sitting in a chair? No. It happens when we're at the gym, when we're standing at the kitchen turning the tap of water on. It happens when we're pushing a heavy door open. It's happening when we're upright against gravity, usually moving.
Yeah.
So if we are not training the pelvic floor upright against gravity in multiple planes of motion, training the pelvic floor dynamically, we're missing a huge opportunity. So kind of like how I was saying in fitness, if I want to run a marathon, I have to run. That's principle specificity. I'm not going to train for marathon by mountain climbing.
Right.
If I want to train my pelvic floor to not leak when I'm exercising or when I'm, carrying groceries, well, I have to train my pelvic floor in movements that mimic carrying groceries or being at the gym. So the method again is more than just exercise. It's very much posture, it's breath, it's lifestyle, hydration, constipation, how you hold your pelvis. Like so many other things come into play there that are going to make the exercises more effective. So many people think, well, I'm just going to do these exercises. Kim said it's going to fix my problem. And a lot of people do get results and then they think, great, I'm done.
Right.
And then they leave and then they come back and they're like, yeah, I really should have stayed up with it because now the symptoms are back. It's like the brushing and flossing, right? We have to keep doing it. I'm not saying you always have to be with me to do it. Once you learn the principles, you can carry on and do them yourself. But you do, if you incorporate them into Pilates, yoga, resistance training, whatever it is you're doing for what you should be doing, at least for a workout, then you don't have to have this pelvic floor muscle training workout and then your other workout. We're combining the two together to make it more holistic and whole body.
Well, this is good. Now, you've worked with thousands of women over the years. What is the biggest complaint, the most common complaint that they've given to you?
I would say prolapse is the one that is the most challenging. It's the one that really halts people in their tracks. It's the one that, again, nobody knows about it. Nobody is screened for it. They are sidelined by this diagnosis and they say, well, I've been having pap smears for 30 years. Why didn't anybody tell me this along the way?
Sure.
So they're very angry and the symptoms are very bothersome. Some people are told they can't run or jump or lift weights. And now, especially post-menopause, what are we hearing with the menopause conversation? You have to lift weights. You have to do impact exercise. So there's this huge disconnect. There was a study that looked at it was close to, I believe, 4,000 women. 46% of women stop exercising because of their pelvic floor. And this is actually, it was a huge range of ages, but a lot of it is younger women. So if we think of how many years women go without the impact, without the resistance training, think of the risks of osteoporosis, cardiovascular disease, diabetes, like all these things that we're now becoming very aware of having an increased risk of being post-menopause. And we've missed this huge opportunity here because I was afraid it was going to make my incontinence worse. I was afraid it was going to make my prolapse worse. My doctor told me not to do those things. So in the effort of trying to, quote unquote, protect the pelvic floor, we've now just further increased sedentary lifestyle and the risk factors that we face post-menopause.
This is a wild question, but I ask wild questions sometimes. Does any woman ever come to you and say, look at me down there, Kim, and tell me what I have, what's going on? Or you wait to get some sort of try these exercises and then,
Yeah, it's out of my scope to do any internal evaluation. There are people who have tried to send me images.
Sure.
Some people have, and I just block them. I make it very clear I cannot diagnose. I refer everybody. First line, go see a pelvic floor physical therapist.
Yeah.
That's always your first line and always who I recommend that you see.
Right.
And I can help. I can help people with their telling me what their symptoms are. I can say, sounds like this, but I can't tell you what that is for sure. However, regardless of what you have, regardless of maybe you have nothing, you just have symptoms of something and it could be tension related. Regardless of if you're struggling with incontinence or struggling with prolapse, struggling with pain, the principles stay pretty much the same.
Yeah.
We have to optimize your posture, make sure you're not constipated, make sure you remove bladder irritants, stay hydrated. Let's work on the synergy of the diaphragm and the pelvic floor. Let's do some voluntary activation and relaxation with the pelvic floor, reminding the pelvic floor of its range of motion. Now we're going to do a few more sets and reps. Now we're going to coordinate that into whole body movement. Now we're going to add some power, some more explosive move. We're going to add some weight. You're going to carry weights in your hand so it's under load. So the principles are going to stay pretty much the same. We have a little nuance in there maybe for specifically maybe tightness or pelvic pain people, but regardless of what you are dealing with, you still have a pelvic floor. You still need the same fundamental principles.
Right. So, and you deal with women on all different stages of their life, right? From like, when would someone start doing exercises in their 20s, before their 20s? I mean, and all the way.
In an ideal world, if we taught this to kids when we're teaching them about the menstrual cycle, about sexual health, about the bodies, if we planted the seed about the pelvic floor, male and female, females menstruate, females, many of which will become pregnant and give birth. All females will, if they reach midlife, will go through menopause. These are risk factors. So let's how you move, how you make sure you bring your pelvic floor into movement, and see a pelvic floor physiotherapist once a year. So if we were told that at a young age, that's when we should start. And then I recommend seeing a pelvic floor physical therapist once you become sexually active, and again, once a year for the rest of your life.
Wow. So, and then you said, I think on your website that your oldest client is like what, in her 90s?
93.
Wow. And it's so
Yeah.
so your body constantly changes, obviously, right? So
Yep.
this, whatever, if like you said before, like it can't hurt, right? Like if someone said you need a surgery, there's no harm in just starting these exercises.
No,
Right.
and if somebody had very advanced prolapse, nothing is going to reverse that. I would still say you have to come and learn these principles because, as I said earlier, after your surgery, it's even now more important for you to make sure. I think a reason why there is such a high recurrence after pelvic surgeries or failure rate is because nobody talks about constipation. If people are constipated, that is always going to be a contributing factor. And if they now go have their prolapse repaired and they're still constipated, guess what's going to happen? Same thing. They're going to be back on the table, basically. So I think that a big reason why we have such a high recurrence is because we are not addressing root causes. We are not doing the pelvic floor PT. We're not addressing posture, constipation, hydration, all the lifestyle things, and consistent pelvic floor muscle training. So then they go have surgery and they think, well, I have this problem. Now it's fixed. Sure, it may have fixed kind of the anatomy to some extent, but we now have scar tissue. A lot of people are offered a hysterectomy. Well, while I'm in there, I might as well take it out. You don't need it anymore. Terrible advice. Hysterectomy increases the risk of prolapse and incontinence, and nobody is told that. So women have really been underserved, poorly served for a very long time. And it's not our fault, your fault, my fault. We just didn't have the information. Yeah. Now that we are having the information, it's now really up to us to do the work. We have to take agency over our health. We can't rely on a doctor to quote unquote fix us. That may be part of our journey, but we have to do the work to prepare for that surgery, recover from that surgery, and retrain afterwards and maintain for the rest of our lives.
I just want to mention that you have a great blog about constipation on your website. Kim, tell us everyone about your website, where to find you, because first off, before we even keep going, that in itself, that blog post is fantastic on constipation. I learned so much from it, but tell everyone.
VaginaCoach.com is my main site, buffmuff.com. You can also go and learn more about the method. But constipation is a major contributor to pelvic floor dysfunction, and it's never addressed. And if we're straining to poop every day or multiple times a day, that's pressure downwards. We're going to contribute to prolapse or make an existing one worse. When we are not getting our bowels emptied, it's going to make us feel like we have to pee more often, more urgently. And we're also not literally getting the SHIT out. We need to poop for reasons to get the toxins out. And if we're not, then we're going to start feeling cranky-pated and awful because, first of all, you've got a big, large mass in there. You're going to feel like you need to pee more. The pressure on your pelvis is going to be immense, but you're also not getting all the garbage out.
Yeah. Do men have a pelvic floor?
Hmm. They
Yeah.
do.
And they can they benefit from exercising it as well?
Yeah, they are not as at risk of pelvic floor dysfunction as we are.
Mhm.
They usually, the first, for most men, it's prostate issues.
Yeah.
Some men can deal with pelvic pain issues. They can deal with constipation. They can deal with tightness just as we can. They don't have a vagina. They don't have the menstrual cycle. They don't go through menopause. They don't
Mm.
have the fluctuating
Yeah.
hormones. So they don't become pregnant, give birth. So they're much less at risk, but they are not immune. They do have a pelvic floor. But the vaginal opening, the uterus, the menstrual cycle, the pregnancy, childbirth, the menopause, all of that is increasing
Mm.
our risks and means we need more attention.
Because yeah, I agree with you. But they're also, on a separate topic, men and their prostate, they go through almost like similar stuff where the urgency, they constantly
Yep.
have to go, they have to wake up in the middle of the night. And then I just wonder, maybe they could benefit from
Thousand
not
percent.
these,
I get
yeah,
asked
these
all the
exercises.
time, will this work for
Yeah,
my husband? And
yeah.
yes, same principles apply, posture, breath, all the same things. We just use different cueing and imagery for men than we would do for women.
Wow.
And yeah, so it's very important. And the other piece that I wanted to add is in the research, there is evidence that doing pelvic floor muscle training prior to prostate surgery will lead to better outcomes and less likelihood of having the postpartum urinary challenges. Why is that research not being done on women and women's pelvic surgeries? Right? The whole prehab, rehab, maintenance concept is left out of the conversation, like a lot of things are in women's health.
It's really shocking. I guess when I was younger, I didn't really get it. I didn't realize that, you always heard, oh, you go through the changes, you get older and you go through it, but that was it, and
Yep.
everyone seemed like they were okay. You'd see your aunt or your mother kind of fanning herself, like, oh, hot flashes, okay. But gosh, when you get here, you're like, wow, I mean, it feels like every single aspect of your body is affected.
Yep.
And then
Thousand
and
percent.
then you go to the OBGYN or whatever, and I've been told so many times in the last few years, "Well, welcome to your 50s," or that's like and I the last time is when I was like, "Okay, nuh-uh, no, it ends here,"
Yep.
because this has gotta get out. There is no reason in this day and age that women are scratching their heads like, "What's going on? I don't know. I'm being told to just suck it up."
Hmm.
It's infuriating. It
Yeah.
really is.
Yeah.
It's infuriating. So I applaud you in all that you're doing. You also I just want to give you I just want to tell people exactly what you've done. So you also co-founded Bellies Inc., a support band for pregnant women, which I feel like I used back in the day. I don't
Oh
know how
yeah.
long. Yeah, I mean, I had one. It was like had the lines. When I saw it on your website, I was like, "Oh my god, I think I totally had one." But that was back in probably 2006. So I don't even know if you had it then.
That would have been
Oh,
we founded the company in 2011. We
so
launched the product. I believe it was 2013,
okay.
2014. Yeah.
Okay. So, but I had, I guess, a similar one because that was another thing. I was like, why aren't we helping this tremendously heavy, stomach, so you did that. You hold certification courses to teach women how to, right, teach these exercises. And
Hmm.
you also have, again, this is fantastic. You have a podcast called Between Two Lips. I mean, Kim, it keeps getting better. The names just keep getting better. So, and you do that how often? And once a week or more than that? And you have the experts on?
Podcast is once a week.
Yeah. So
Yeah.
everyone should listen to that too. I mean, I learned so much and gosh, I love doing the show because of when I meet people like you and all these women who are just informing us and educating us. And I feel like we have nowhere to go. We just have nowhere to go to find out so much. So, most people, as we mentioned, most people think Kegels could just work by themselves. That now I've learned is a joke. I mean, it's just like doing biceps, doing bicep curls, and expecting your whole body to be fantastic. But you talk about also the relationship between helping women with incontinence and prolapse, and it really helps them their confidence wise and their view of themselves. How does that work?
Yeah. when you look at the ads on the TV, that, the light bladder leakage is just part of being a woman, and it shows this handsome man with a motorcycle, and it shows you these crinkly black diapers that are supposed to somehow be sexy. We put them on, and we somehow are supposed to feel like, oh, everything's fine now.
We are so
That
hot
is a
with these.
lie. That is not happening. It
Yeah.
really takes a hit on your confidence and your
Mhm.
self-esteem and your ability to be present at work, present with your family, with your friends, committing to social outings. If you're constantly thinking, am
Mm.
I leaking? Is it through
Right.
my pad? Can people smell it? Is there a bathroom nearby? Does my partner see or feel the bulge in my vagina? Like, it's
Right.
this constant distraction, and it takes us away from a lot of,
Mm.
of being present, literally. And so when people then, first of all, just being told the information and not being dismissed, and having somebody affirm that this is not normal and that this is what they've been struggling with and it's not
Mm.
just part of being a woman, that in and of itself gives people some agency, some power, that they are in control now. They don't have to rely on somebody to quote unquote fix them.
Right.
And then once they start feeling better and stronger, a lot of people have, again, been told you can't lift weights because you have a prolapse. You can't do
Mhm.
this because you have incontinence.
Right.
And when I show them how to do it and they start doing it, and now my back pain's gone, I lift up, I play with my grandkids. I just had a message yesterday from a woman saying, I, I was taking care of I think she said she had 4 grandchildren all day. And usually she couldn't lift them. She was always in the bathroom multiple
Mm.
times. She said, I went through the whole day. I was lifting the kids. I was playing with them. I wasn't rushing to the bathroom. It's life changing when
Mm.
that happens. Waking at night to pee is another big win that a lot of people have. When you think of, you know, 4, 5, 6 times a night, people are waking up thinking their bladder has woken them up when it really isn't. They've just become conditioned to do so. They wake up, they empty. Now the bladder gets trained to signal them when it's not full. And now, 6 times a night to wake up, you're never getting restful sleep.
Mm.
And we know how important sleep is for our health, one of the most important factors. And if we are constantly being disrupted and waking up, well, we're not getting that deep, restorative, reparative sleep, which is also then going to make your symptoms exacerbated. Lack of
Mm.
sleep makes you feel more symptomatic with
Yeah.
incontinence and prolapse. So
Mm.
confidence it just naturally comes back when people eliminate the symptoms, they eliminate the pain, they don't have to pack pads everywhere. They have this freedom back, and they're also now lifting weights, and they are literally
Mm.
stronger than they were before, and not being told this is not safe or you can't do this, and feeling very isolated and small and like they can't do anything. Now
Mm.
the world is their oyster again.
Mm. I have a question for you, because what you said earlier, I remember after I think my third child was born. They're all older now, in college, but they were like, we had a little trampoline. They're like, "Come on the trampoline, mommy," and I went for like a couple of minutes. I was like, "Oh my god, no, I have to go to the bathroom," and then I thought about, you think about that going. If I had only known this about this, then I could have gone on the trampoline more. I could have, had that, like you said, been in the present um, moment. So I talk about this in relation to midlife and menopause, but it's really, as you mentioned, post pregnancy. It's things like this where that again no one talks about, and that if you had just kind of handled it or dealt with it a little earlier or when it was happening, it wouldn't get to, if you kept up with the exercises, it wouldn't get to the point that it does at
Yeah,
midlife.
it absolutely will change the trajectory. But I also want people to know, as in case of the 93-year-old, it's never too late to
Mm.
make change. And even if you have been suffering for years, even if you have never given birth, I want to make the point that you don't have
Mm.
to have been pregnant
Right,
at any point.
right.
Even if you went through menopause 20 years ago, that doesn't mean that it's too far gone, that you can't make
Mm.
any change. You
Mm.
you can the best time is now that you're learning this, the best time to take action is now. The other thing I want to highlight from a menopause perspective is the estrogen component.
Mm.
I talked about protein. We need building blocks. I've talked about the stimulus, meaning the exercise and loading the muscles. We
Yeah.
also need estrogen. And when we reach our menopause, we are now in this low estrogen state forever.
Mhm.
When we are postpartum, we're in a low estrogen state for a period of time. When we go through our menstrual cycles, we go up and down, high, low, high, low,
Mm.
high, low. Menopause comes and we are in that forever low.
Mm.
That is when we want to consider I consider it essential that all women start vaginal estrogen, and they use vaginal estrogen and or vaginal DHEA from the start
Oh,
of their menopause for the rest of their life. That is
wow.
another component that helps keep the tissues moist, supple, juicy, healthy, not prone to infection. Our risk of recurrent UTIs it skyrockets post
Yeah.
menopause,
Yeah.
and a lot of that is because of estrogen. It disrupts the vaginal microbiome. It disrupts the pH level.
Mhm.
It changes the actual tissues, so we can lose our labia.
Mm.
The tip of the urethra can become more exposed. All of these things leading us to being more prone to infection, more pain, more dryness, itchiness, burning, difficulty with insertive sex. And that's not fun. And again, so many
Mm.
people have been denied because as everybody thought estrogen gives you cancer.
Yep.
Vaginal estrogen does not give you cancer.
Mm.
There's no links to any cancers of any kind, no blood clots, no heart attack, no stroke. There is risk of recurrent UTIs and urosepsis if you don't have it on board, which
Right.
is life threatening,
Right.
and loads of evidence for that. So vaginal estrogen, I consider an essential. I say nutrient. It's not really a nutrient, but
Yeah.
something you need on board.
I agree with you. And you know what? It's kind of hard to get because I went to, again, OBGYN. They're like, oh, we don't prescribe that. So I had to go to a functional medicine doctor, and it's just outrageous. It's outrageous to me.
That's
Um,
hopefully going to change. Just
yes,
one thing on that. July
with the FDA.
17th. Yes.
Yeah.
Hopefully that will change. But there
Yeah.
was a whole generation of women who missed out. There was a whole generation of doctors who were not trained and misinformed.
Yeah.
So we are living in that hangover, but things are changing.
Mm.
And I would say find a different care provider.
Yeah.
There's loads of them who will practice online now as well. But yeah, that July
Mm.
17th meeting was a
Yeah.
huge win.
Yeah. I hope so. I hope they remove that warning.
Hmm.
One last question. What role does the pelvic floor have to do with sex, and how does it affect sex as we age?
So I mentioned that we have those three different layers.
Yeah.
The external layer is the one where it would be most responsible from a sexual response perspective.
Hmm.
Sex doesn't have to be insertion, but insertion is often a part of sex with or without a partner. If we have dry tissues, if we have tight muscles, if we're low in estrogen, if we have that restriction, like the tightness that restricts blood flow and circulation, we may not be able to reach orgasm. We're not going to have the blood flow and circulation we need to help with that for lubrication and achieving orgasm.
Mm.
Sensation wise, it may be that if we're very lax, if the muscles don't have a lot of tone, we don't have a lot of sensation. But if they are too high tone, then it may be painful for us and insertion may not be possible. So having an optimally functioning group of muscles, having healthy, robust tissue,
Right.
muscles that can relax, that can contract. An orgasm, by the way, is like an involuntary Kegel
Hmm.
exercise. Sex is good for the pelvic floor. But again, a lot of people will avoid sexual activity for fear of their partner seeing. What if I leak? What if they feel the bulge? It hurts. So of course, if something hurts, you're not going to want to do it. And again, it's not just do Kegel exercises.
Yeah.
Maybe it's releasing tension in the muscles. Maybe it's some breath work. Maybe it's some vaginal estrogen. Maybe it's a moisturizer. Maybe it's a lubricant. Maybe it's all of those things.
Right.
So
Right.
yeah, it plays a huge role in sexual health.
Oh my gosh. Kim, is there anything else, if you had to give any advice to any woman who's struggling, what would be the top thing you would tell them?
See a pelvic floor physical therapist. It's always
Yeah.
my number one, always.
Yeah. And then sign up for your community and
And then
start
sign
doing
up for
those
Buff Muff. Yeah.
and start doing all those exercises like I will be doing. Um, we can all comment together, but I just wanted to say, Kim Vopni, the Vagina Coach, is probably the most eye-opening conversation I have ever had on the show because I feel like, and I've had urologists and I've had functional medicine doctors and cardiologists, but Kim, you, my friend, something powerful. This is an amazing conversation. Truly, truly.
Thank you.
A- And I want to thank you for coming on. And I contacted you. I'm like, you don't know who I am, but I think you're awesome. And would you come on? So, everybody, please go to her website, the Vagina Coach, all the programs that she offers. Do you still do Kegels and cocktails or not anymore?
Yes, I typically host that once a year in person. There's a few people who host them in other cities around the world as well. But
That's great.
I'm determined this next year to actually do it a few more times a year. Not just I usually hold it during World Continence Week, and that's in June. But I want to I want to do it a few more times. I really love the in person
Yeah.
opportunities to be with people. So yeah, my goal is
Oh.
to do it at least twice a year.
Well, maybe we can bring you into New York so you could do it. That
I
would
would love
be,
to do that.
oh my
Yeah,
God, that would be amazing. All right.
yeah.
Oh my God. So, again, a big thank you. Everyone, go to her website, sign up. She's amazing. And I think this is amazing. I think it's an amazing conversation. Thank you for enlightening
Thank you.
us.
You're welcome. Thanks for having me.
You're very welcome. I'm Jill Conway. Thank you for listening to the show, Celebrating Women. I hope you're inspired to pursue your own goals, believe in yourself, and dream bigger. Everybody, your voice matters, and your story can help others. I hope you join me next time and share this podcast with a friend, because every single woman needs to hear it. Thank you so much. Bye, everybody.